Thank you, Wes. It is now 7:18, and one thing that no one wants is a health scare, and there are few words more difficult to hear than "you have cancer." We know that there are a lot of genes that are linked to breast cancer, the most famous one being the Breca gene, due to people like Angelina Jolie speaking out about it. But it's not just breast cancer that it's connected to. It's also connected to ovarian and other cancers as well. Joining me this morning is Dr. Allison DiPasquale, a breast surgeon from Methodist Hospital. Good morning, Allison. Thank you so much for being this morning here with us. Let us start right away talking about the Breca gene. What is it? How do you test for it? And should everyone actually test for that, every woman anyway?
So the Breca gene is a tumor suppressor gene, which means that in its normal state, it actually keeps cancer at bay. It suppresses cancer. When it has a mutation, as seen in Angelina Jolie, then its ability to suppress cancer, keep cancer at bay, is gone, and that's how cancer develops. So if you have a mutation in the gene, it does not mean you will inherit a case of cancer. It means that you can have a high-risk features that allow you to have cancer in the future. In terms of who should be tested for it, really you should be speaking to your primary care physician, your OB/GYN, your breast surgeon about your family history, because it is genetically linked.
Absolutely. And what about men? We don't hear a lot of conversation about men and breast cancer, but we do know that men can also get breast cancer as well.
Yes, that's correct. And actually the BRCA2 gene is most closely associated with male breast cancer. Not only male breast cancer, but also early onset prostate cancer.
And also, are there some other genetic mutations that can be tested for? And again, if you have that mutation, does that mean you'll get cancer, or does it just mean you have that higher likelihood?
Yeah, if you have the BRCA mutation, it has a higher likelihood of cancer. With women, it can be anywhere from 40 to 60% lifetime risk of getting breast cancer, and the same with ovarian cancer.
We want to switch gears to something else that everyone has been talking about. I guess the last 2 weeks, I think, is when this information came out, and that's the American Cancer Society's new recommendations for mammograms. And they went from age 45, or I think it was initially age 40, and now they're saying 45. That's what it is. We know that there has been a lot of reaction from both women, OB/GYNs, and also primary care providers about this. Plain and simple, what age do you think that women should be getting a mammogram?
I think early detection is key. I really do. Mammogram is a way to detect breast cancer early onset, but in terms of the guidelines, they're very confusing. Some say 40, some say 45, but it's based on your risk factor. So average risk woman is a woman who does not have a family history of breast cancer, has never had any chest wall radiation. And those patients, you can have that conversation. You know, the new guidelines say 45, but they offer up the availability for the women to get testing at 40 if they so choose. So I think the main thing is letting the patient choose and be involved in their own health care is very important. So speaking with your patient, talking to them, asking them, are you anxious about getting mammograms and callbacks, or would you like to start early? Would you like to start later? And I think that's the main thing to take home, is really each patient is individual, and allow each patient to participate in their own care.
And I also think it's very important that you should always really know your family history. You'd be amazed at how many people don't know their family histories in terms of certain, genetically linked diseases and disorders, and this is one where it helps to know.
Yes.
That it's something that's running in your family.
Yes, because then if it is a family history, you would be in a high-risk category, and those guidelines would not apply to you.
Absolutely. Thank you so much for being here with us this morning. We're going to have this full interview and some extra information as well online at WFA.com. That'll be about after 9 o'clock. Our time right now is 7:22. Still to come this morning, the warning about parking in